Absolutely. So myocarditis, essentially, it's an inflammation of the heart muscle. It's mostly an immune response of the body in relation to most often a viral infection. And it is quite common if you look at the CDC data, acquiring on patients all over the US, it occurs to a rate of about, 10 to 20 per million adults. Most likely caused by Coxsackie viruses, for instance. But really anything that can trigger an inflammatory response can trigger myocarditis. Usually patients present with chest pain, sometimes shortness of breath. Sometimes because you have an inflammatory response, you have arrhythmias of the heart. So people can have palpitations, can have, sometimes passing out, and they present to medical attention. Okay, so if you look at, again, there's a recent paper in JAMA published looking at CDC data collected over the last year and a half. The number of patients that were diagnosed with myocarditis is 50 per million doses administered, so 50 out of a million. Just to put it in reference, again, a normal person would probably be in the range of 10 per million of getting myocarditis. And then a COVID-infected patients, the rate's about 120 per million to get myocarditis. So it is rare, about half compared to a COVID-related infection, but more common than it would be expected just from other viruses.
Dr. Klein, have we seen people die from a myocarditis side effect from getting the vaccine?
So I have not personally, and again, looking at our center, we have not seen that happening. Usually the forms of myocarditis are very mild. Usually they present after the second dose of the vaccine, usually within the first 48, 72 hours. And again, most people come in with chest pain and palpitations. They are treated with anti-inflammatory. So again, if you look at the CDC data, 97% of the patients recover and are sent home within a couple of days. So again, this is a pretty extreme case if that's related to it. Not really. Again, most patients will come in with complaints of chest pain, and then usually when that is, in the history, the physicians will run blood tests, such as troponin, which is a protein in the heart muscle, and usually you see that elevated in the blood. In fact, 99% of the patients who have myocarditis have troponin elevations. You also see changes in the EKG. So again, it's very unusual for someone that has myocarditis to be clinically silent until they die. And again, that usually if he had received the vaccine 5 weeks prior, it's very, very late to be associated. Most common cases are reported within a few days after the second dose. But in fact, to pass 5.5 weeks after a vaccine, it's without intervening diagnosis is just very unusual. Absolutely. So myocarditis in general, again, there are our own body's anti-inflammatory response, let's say, to a viral infection. And it's really each own's individual response, that immune response that's very different. So you could be a completely, totally healthy, normal person and still get myocarditis. In fact, most people are actually healthy in general with myocarditis. So again, the immune response that we see to vaccines sometimes can cause it. Again, it's much rarer than the disease itself, but usually patients are symptomatic and they have very, very mild symptoms, most likely because they don't have comorbidities, right? So they're healthy adults that don't have other cardiac comorbidities. So therefore, their course is very, very benign and resolves within a few days. Yeah, I think it's not known, and the thought is that because it elicits a very strong immune response, it's just the immune response that's triggered leading to the myocarditis. In the old days, we used to have problems like smallpox vaccine. Actually, the smallpox vaccine can cause myocarditis in rare cases. So again, it's just triggering a very strong immune response that's probably in susceptible individuals. It's related to development of myocarditis. I mean, obviously, any medical product that has side effects, people are rightfully, so to be concerned. However, they have to put in balance what is the risk of them developing the same problem without getting vaccinated. And if you look at the same age group, young males, for instance, the risk of getting myocarditis from COVID, it's at least twice as high as getting myocarditis from the vaccine. So I think in balance, it's still a very, very safe vaccine, and again, protects against many, many other issues. And I would not withhold the vaccination because of that concern. Obviously, you have to be alerted, and if you do develop chest pains, you have to contact your physician to get a diagnosis. but I would not withhold the vaccine just based on that concern alone.